which commonly used prescription and over-the-counter based medications raise blood sugars. Not only do these drugs make controlling blood sugars much more difficult, but you'll end up unnecessarily being blamed for something that was out of your control. Today, we will cover the top 5 biggest offenders that make managing your diabetes far worse. And I'll bet you're either currently using one of them right now, have had to take them in the past, or will have to rely upon them at some point in the near future. Welcome to the Resilient Diabetic. This is the channel we turn ordinary, struggling diabetics into extraordinary, well-controlled diabetics. If you're new to this channel, I welcome you. My name is Jay Sampat. Don't forget to subscribe and hit that gray notification bell. That way you'll be alerted when new life-changing episodes have been published. And if you learned something new today, please smash that like button for me. As with all my videos, this should not be considered personal medical advice. This is my interpretation of the latest research. If you want medical advice, please always consult your physician. When diabetes creeps into our lives, it often brings other health problems with it. And these complications may require additional treatments. As we age, we are also urged to take other medications to support health, including trying to lower our cholesterol levels, our blood pressure, and much more. In fact, some of the most common non-diabetic medications taken by people living with diabetes are well known for raising blood sugars in most patients, whether they have or they don't have diabetes. When our blood glucose levels unexpectedly trends high, our minds run through a list of questions. What have I been eating over the past few days? Like a meal with too much carbohydrates or not enough exercise? Is there something causing me stress? Am I fighting a cold? Did I take the right amounts of insulin? Or did I forget to take my medications? All great questions. But you may also want to turn your attention towards your medicine cabinet. So, you are not to blame. It's actually not your fault. Common drugs that treat certain conditions actually raise blood sugar levels and make glucose management much more difficult. But just because a medication can raise blood sugars doesn't mean that you should not take them, especially if you need it. Still, you should be aware of the possibility and work with your doctors to find the best approach for you. And here are the 5 most common medications that can have a negative impact on your blood sugar control for those of us managing our diabetes. The number 1 offender, corticosteroids, often simply referred to as steroids. There are 2 types of steroids you should be aware of. One subset called anabolic steroids, like testosterone. Anabolic means to build or to create. These do not raise blood sugars. The steroids of concern are catabolic in nature, meaning they break things apart to reduce pain, swelling, and inflammation. They treat diseases like rheumatoid arthritis, lupus, skin conditions like rashes, asthma, joint pain, allergies, and other injuries characterized by swelling and inflammation. This could even simply include a painful knee or a shoulder injury. Those catabolic steroids that are injected or ingested by the mouth can significantly increase blood glucose levels for days or even weeks. The dose, duration, and how these catabolic steroids enter your system are all important in determining how your blood glucose may be affected and how closely your diabetic medications need to be monitored. Oral steroid medications and injections directly into the muscle or joint, like an injection deep into your sore, damaged shoulder, will almost always increase blood glucose because this type of administration affects the whole body, what doctors refer to as systemic absorption. The peak elevation tends to occur anywhere from 5 to 84 hours after the injection. During this time, for at least the next 5 days, monitor your blood sugars no less than 4 times a day. And then, with the aid of your doctor, modify your insulin or other oral medication needs. Corticosteroids used as inhalers or topical creams aren't likely to affect blood glucose because they don't enter the bloodstream in great enough quantities. Nonetheless, while the risk may be low for these type of steroids, blood glucose still needs to be monitored closely, irrespective if it's inhaled, given orally, topical, or injected. Second on our list are drugs that treat anxiety, ADHD, depression, and other mental health problems. Antidepressants. What does the latest research now show? 1 in 6 U.S. adults now takes a psychiatric medication. The number one cause of disability here in the United States and around the world is depression. It affects over 322 million people. Many people rely on antidepressant medications, but now these meds are being given to help people overcome or at least deal with the emotional imbalances that are often present when living with diabetes, especially those who have been recently diagnosed. The problem? They can also make things worse by increasing blood sugar levels and making it more difficult to find success in treating the disease at the same time. There is a wealth of evidence from the scientific community that seems to indicate that antidepressants increase the risk of developing type 2 diabetes, especially for those who are already pre-diabetic. It's already well known that antidepressants tend to cause weight gain, another risk factor for type 2 diabetes. Evidence indicate that increased risk exists independent of weight gain, meaning that there may be other factors in play. Like many of the medications on the list today, whether or not to use antidepressants comes down to weighing the risks of elevated blood sugar levels against the risk of not using this drug. This is something that everyone should talk to their doctor about before adding or changing any of these medications. Third on our list, drugs that treat high blood pressure such as beta blockers and or diuretics. About 67% of adults with type 2 diabetes struggles with high blood pressure. And I have done a previous episode on diabetes and blood pressure explaining the strong correlations. I will put a link to that important video in the description box below if you've missed it. So it should come as no surprise that a large majority of people with diabetes take medications to help lower their blood pressure. That is to decrease the risk of heart attacks and strokes. Unfortunately, some of the most common blood pressure medications are known to also increase blood glucose levels. Beta blockers can reduce the body's ability to secrete insulin, which can lead to some people needing to supplement with insulin shots, while those already on insulin may need to increase their dose. Diuretics, on the other hand, work by flushing out sodium and by extension, potassium from the body. Since potassium is vital for glucose uptake into cells, these meds can also raise blood sugars too. Fourth, the one that damaged me the most and the one I personally battled my doctors over: statins. Statins are used to lower LDL or the bad cholesterol and was thought to be a vital therapy for everyone, especially as diabetics, for preventing heart disease and stroke. But they can also increase blood sugar levels and significantly. And what is worse, people with prediabetes using a statin is linked with a greater risk of developing full-blown diabetes. A study published in October 2017 in the BMJ Open Diabetes and Research Care Journal, which tracked people with prediabetes for 10 years, found that statin use was associated with a 30% higher risk of developing full-blown diabetes. When I was diagnosed as a late onset insulin-dependent diabetic due to an autoimmune attack which ended up destroying my pancreas, my doctors then put the fear of God in me that I was going to die of a heart attack if I did not take these miracle pills. So I did, but very reluctantly. I noticed two things. First, my blood sugars began to slowly creep up over time. No matter what I tried, bringing it down was very difficult without the excessive use of insulin. Not only that, but I was served a double whammy. Severe muscle pains which developed, making exercise extremely difficult. I have been weight training my entire life, and I know my body extremely well. It literally felt like my body was coming apart. Severe shoulder, forearm, and overall muscle aches and pains. And when I brought this up to my doctors, they both said that as my general practitioner and endocrinologist, I was just getting old. They insisted I continue taking it. So let me get this straight. You want me to continue taking this medication that inhibits my ability to not only exercise, which keeps my blood sugars really well controlled, but it also raises my blood sugars up and significantly? Am I the crazy one here? I personally do not follow advice blindly. I could clearly and immediately see the correlations and then searched out for answers. Was I alone? Is this common? I then came across David Diamond, who lectures to doctors around the country. And he then opened the real world around me. How does a pharmaceutical industry get away with claims statins reduce the risk of heart attack by 36%? Furthermore, how did they con the medical establishment into recommending these to just around everyone? Why are most doctors not aware that they can raise blood sugars and cause severe muscle damage? If you do a bit of investigative work, you will see the lengths at which the statin industry has gone to conceal those side effects. I will put an important link to his video in that description box below. And yes, when you do watch it, it will make you sick to your stomach. Send it to your doctors. This will change your doctor's views and understandings of this drug too. Fifth are antibiotics. Chances are at some point in your life, you've taken a course of antibiotics. Maybe you took penicillin as a child for strep throat, or perhaps you've been given azithromycin for a sinus or an upper respiratory infection. No doubt, antibiotics are lifesavers in most instances. Antibiotics are medications that fight infections caused by bacteria. So they kill bacteria or keep them from reproducing. Having diabetes raises the risk of a number of types of bacterial infections, including UTI, skin infections, and infections of the hand and feet. So, if you do get an infection, it's equally as important to understand A, the type of infection that you have, B, how should it be treated, and C, the best type of treatment. And unfortunately, some of the most commonly prescribed antibiotics have a tendency to not only raise blood sugar levels, but cause dangerous blood sugar fluctuations too. If you are pre-diabetic and at the risk of developing type 2 diabetes, you might be interested in a study published in the Journal of Clinical Endocrinology and Metabolism in 2015. The researchers looked at information from 170,000 Danish citizens who had type 2 diabetes and compared their antibiotic use with citizens who do not have diabetes, the control group. Those in the control group who filed 2 to 4 prescriptions for antibiotics had a 23% higher risk of diabetes. Those who filled 5 or more prescriptions had a 53% higher risk. That is devastating. Now, this study does not mean that taking antibiotics causes diabetes, but the authors suggest that antibiotics can disrupt the microbe in the gut, which in turn can change insulin sensitivity and glucose tolerance, thus increasing the likelihood of type 2 diabetes. Despite these risks, you may find yourself needing to take one or more of these medications while managing your diabetes. Fortunately, you can take a few steps to help keep your blood sugars controlled, including the following. Pause before immediately taking a new medication, especially over-the-counter ones. You should always consult the pharmacist or your doctor before starting any over-the-counter medications. Clear everything with your main diabetic doctor. If a specialist, like an orthopedist or a psychiatrist, prescribes a new medication, check in with your certified diabetic educator or primary care doctor to ensure that it's okay to take. Because more than likely, you will need to coordinate any necessary adjustments to your diabetic medications. Take care of yourself. You must prioritize diet and exercise if you're taking any medications that affect blood sugar control. Physical activity with a low-carb approach can and will help prevent significant spikes. That way, aggressive changes in medication requirements can be minimized. One rule you must follow as a diabetic: always try and add in one variable or one medication at a time, and then check your blood sugars against the norm. You may be unique to a certain medication that raises or lowers blood sugars. That way, you can isolate it and know right away that that is your offender. Besides this list, what prescription or over-the-counter medications have you taken that's raised your blood sugars? We, as a diabetic community, would love to learn and know more. Please share that list in the comment section below. I will also set up a playlist for you on videos specifically on how foods affect our diabetic bodies. Are the modern century engineered fruits, fats, grains healthy? What is the connection between food, heart health, high blood pressure, the explosion of diabetes, and now the battle with COVID-19 or the coronavirus? If you're on your desktop or laptop, I want you to use your mouse to click this upcoming box. If you're on your mobile device, please tap that with your fingers. The first is the link to subscribe to this all-important channel. The second is the link on the playlist mentioned on foods. So have a great and productive day, and we will see you soon with another new episode, which are generally released weekly. Bye for now.